عليكم ورحمة الله وبركاته. أهلا بحضراتكم جميعا. سعيد بوجودي مع حضراتكم وبشكر الأستاذ الدكتور محسن بيه الظالمي رئيس المؤتمر على دعوته الكريمة. شكرا للسادة رؤساء الجلسة على التقديم. أنا أحمد صادق استشاري الأمراض الجلدية والتناسلية وهكلم حضراتكم عن البروفايلوبلاستي. ممكن برزنتيشن بعد إذنك؟ اوديو فيجوال ممكن برزنتيشن بعد اذنك؟ شكرا. اوكي، هنتكلم النهارده عن كونسبت البروفايلوبلاستي. وانا قبل ما اطلع سالت صديقي الدكتور مصطفى ودكتور علي بتحبوا نتكلم بيور انجلش ولا نتكلم انجلو عرب؟ فايه اللي حضراتكم تفضلوه؟ Okay, definitely. So. Okay, so we're talking today about the concept of profiloplasty, and to start with, I have all specific disclosures for the talk. This is the aging of the face that we see every day in our aesthetic dermatology practice, and we all know about the different signs that occur, starting by the bone resorption, followed by the sagging of the fat compartments, and then the change in the dermis and the epidermis, as we definitely know. This is definitely a reflection of what goes on deep in the skin. Pathologically, we see that there is a decreased number of expression of hyaluronic acid molecules and also the hyaluronic acid receptors, in addition to decrease in the collagen, the elastic fibers, leading to the decrease in the thickness of the dermis and the subcutaneous fat, in addition to wrinkling of the epidermis. We have to have an anti-aging strategy to deal with each patient. It's not just about injection at specific points with specific techniques, but we have to prevent anti-aging by the supplement of antioxidants, especially systemic ones, also to protect by the use of topical sunscreens, and finally to correct by topical treatments which include retinoids and peptides, and definitely by procedures which we offer our patients. So the concept of profiloplasty is the enhancement and the assessment of one's profile, and this is not a new concept, as I'm going to show you in a few minutes. The four key areas that we address are the forehead, the nose, the cheekbones, and the chin, ensuring proportion and respecting race and gender as well. So non-surgical profiloplasty, medical profiloplasty, which I'm going to talk about today, can be performed by fillers, by thread lifting, by botulinum toxin, and also by other rejuvenation and collagen induction therapy techniques. And I'm going to focus today on the use of fillers for profiloplasty. This is why profiloplasty is really that trendy these days, because everybody is fond of selfie photos. The presence of the selfie cameras from each side of the face and with different and special situations is enhancing the importance of understanding and performing profiloplasty for our patients. And also with the use of the social media and everything that's going on. So this is the start. Actually, the first paper that has been published on profiloplasty is 60 years ago. This is not a new concept, but we have new techniques, or let me say, a newly rediscovered concept. If you'd like to assess the facial beauty of any patient, we always usually use the golden rule of triangles, in which each line has a proportion to the next one by 1 to 1.6. And you can use this website, the anaface.com. You just upload the picture of yourself over there, and it gives you how much do you match this percentage, and gives you a score out of 10. You can give it to your patients, and you can also use it for assessment before and after treatments. I said that we have to respect the race, the gender, and also the age of the patient, because sometimes you can cause true lifting of the face, but other times you cannot provide that with liquid facelift, but you just go into blending of the sagging tissue. So what's the difference between the males and the females in the profile? It starts with the forehead. The females have a flat forehead, but the males tend to have this supraorbital bossing of the supraorbital bony rim. So do not feminize a male forehead by over-injecting the forehead in males. This is the first thing. The second thing is that the cheekbones and the nose are more prominent in males, and there is no lateral curvature on the zygomatic process in males, so also do not feminize a male face. And finally, regarding the big dilemma of the Texas injections, it's supposed to be masculine. Some females need some enhancement for sure, but still, Texas and the injection of the jawline to create a broader jawline and a more prominent chin can be used for females, but this is mainly for males. Respect the different races, because we are not transforming people from a race to another, but we are enhancing the beauty and the nature of each distinct race. We definitely have many aesthetic principles that apply to all different races, the Caucasians. Also those apply to the profile. And we have to respect the length of the nose, the length of the upper lip, its relation to the lower lip, the fullness of the lips as well. And if I'm going to assess a patient for profiloplasty, I always start from up downwards. I start with the forehead and the temples, because if there is hollowness in a feminine forehead, I usually inject in the mid part of the forehead in order to create a smooth, natural, and straight forehead. But for the temples, when there is sunken temples, I inject deep beneath the temporalis muscle on the bone itself in order to correct the hollowness of the temples. Afterwards, I go to the mid-face, and if I need more enhancement of the cheekbones, I inject deeply on the bone as well, and finally define the jawline. Then I go medially. I go for the nose, I go for the tear trough, and I go for the lips and the anterior projection of the chin. So I start laterally by the mobile sector of the face where I can create lifting, and I start from upwards, downwards in order to create gradient lifting there, and then I finish by the midline. I also follow all the aesthetic principles that you all use, and this is applied to each patient, and you have to discuss it properly with your patients in order to have a mutual pre-agreement before we start the procedure itself. You can Google all the principles over there, but what I want to highlight is that respect the anatomy, please. We all know about the different layers of the skin, and we also know about the vascular anatomy. Because when you're injecting filler, whether it's in a profiloplasty or any other technique, you still have to follow the golden rules of a safe and effective practice as well, and I'm going to show you in a video. This is the vascular anatomy of the nose. It's really a bit complex, and there are many anastomosis on the nose, so kindly be gentle when you're injecting the nose. Usually I use a cannula, and I use it in the midline to avoid injecting into any vascular branch. Okay, this is a diagram of the main arterial supply of the face, and I'll show you how I draw it on a patient's face in a few minutes. Also the fat compartments, the superficial ones and the deep ones. You have to know proper anatomy about where you are going to inject and how you are going to use it to enhance the facial expressions. If I'm going to restore volume and to cause lifting, I usually inject in the deep fat compartment directly on the bone with support to the retaining ligaments. But if I'm going to use minimum amount of filler which enhance the facial expressions, I inject in the superficial fat compartment. We use the usual basic injection techniques, the linear retrograde, the depot injection, and everything as usual. And what's really important in your practice is to develop your own sense of injection. You shall know all the techniques, you shall know all the basics, all the rules, listen to all the expertise and KOLs over there, but then develop your own taste of injection. This is just showing you the different injection techniques that you all know about regarding different filler injections. Okay, so this is the profiloplasty. How to enhance the appearance of the profile with injections without any surgery. In this model from the Instagram, you see over there how they injected the lower half of the nose in order to create a more straight nasal bridge, also with some lip filler and anterior projection of the chin. Also over there, you see the correction of the nose itself without anything else and how it affected the face of the patient. Okay, so prior to creating a profiloplasty technique or procedure, you have to have a well-lit room, bring younger photos of the patient to see the effect of aging, photograph the patient, assess globally. It's not just that the patient needs a medical profiloplasty, but you have to assess the patient, just like I mentioned, starting from above downwards of the face. Then you disinfect, anesthetize, and inject in a sitting position in order to allow the sagging of the tissue to be in full function and in order to assess the patient properly and inject below the retaining ligaments to create support to those and minimize sagging of the soft tissue compartments. Contraindications for profiloplasty filler injections are the same like any other filler injection. There is nothing particular regarding this. But I'd like to highlight the vascular complications and how to manage, and most importantly, how to avoid. Whenever I go for injection for any part of the face, there are safe areas which are actually everywhere in the face. But it's about the depth of the injection level. If I know that I'm injecting at the level of the entrance of the facial artery in the face, here at the anterior border of the masseter, crossing with the jawline, I know it's crossing deep. So here, if I'm going to inject filler, it will be superficial and not deep. If I'm going to inject in the nose over there, also I'll be injecting deep at the cheekbones as well, at the infraorbital foramen. I know the vessels are deep, so I inject superficial. So we are just avoiding the anatomy that is dangerous at injections of fillers. So you can find this and how to manage. It's present in the published book of the anatomy and soft filler injections of the orbital region. And we have published this chapter on filler injections of the periorbital region. And you see here how you can manage any vascular complication by immediately recognizing the issue, by asking your assistant to prepare the hyaluronidase enzyme, by doing some warm massage and applying nitroglycerin. Also give the patient aspirin tablets to chew, and then inject the hyaluronidase in a dose of up to 1,500 international units of hyaluronidase as a bolus injection. You can repeat that, and if you have a nearby hyperbaric oxygen chamber, you can refer the patient to as well. Also, this is how to manage any nodules that may be apparent from filler injection techniques. And if you are using a very good filler, if you choose and invest your time in choosing a proper filler to inject, usually you will not be facing such problems. You use a totally aseptic technique, you use a good filler, and then you can rest at night. You cannot always be night dreaming about having such complications. And if you face a nodule, you first have to categorize whether it's a single or a multiple ones, whether it's inflammatory or non-inflammatory, whether it's fluctuant or not, and based on that you can deal with the condition, whether it's infection or allergic reaction, excess amount or encapsulated hematoma. So let's see over here, if you can play the video. Here is how I first assess the vascular anatomy of the patient. Over there I start with the facial artery. I mark the superior labial and inferior labial arteries, the angular artery, also the superficial and deep temporal arteries over there, and then I start assessing the face of the patient. You see over here also, there is something wrong with the video, I'm sorry for that, but then I start for assessing the patient's face, and then I go for injections. Do I always mark the patient's face? No, this is just for demonstration. But if you know the anatomy by heart, you start working on the patient's face as well. This is definitely artistic. This is maybe agreeable and accepted by the patients, or they might think that you are doing a very good job, but this is not mandatory for each patient. Okay, and here we can see also, if you can play the video please. The audio visual, can you play the video please? ممكن نشغل الفيديو? Here we have assessment of the patient, and as you see over there, she has sunken temples. This is how I start from upwards, as I told you, and then I assess the mid face, and apparently she needs some volume over there, and then I go for injection at the angle of the mandible because she has retracted angles and hypotrophied masseter. Then I go for the photography of the patient. And I finalize by the midline as I mentioned. Here I'm injecting the temples deep down on the bone beneath the temporalis muscle in order to create lifting of the temporalis muscle and correcting the hollowness of the temple. For this patient, she had asymmetry between the two temples, so I have not injected the same amount of volume in the two areas. Here I go 1 centimeter below the tail of the eyebrow down to the bone, and I aspirate well, and then I inject in a bolus technique. I did the same thing to the lateral fat compartment of the mid-face at the zygoma, and also the medial cheek fat compartment. I am injecting in a bolus technique. Okay, sir, this is the end. And now at the angle of the mandible, beneath the masseter, directly on the bone. This patient had a 5 ml total of filler for full face correction, improving her profile as well. This is for the mid-face. Now for the masseter on the other side. And for the anterior protrusion of the chin as well. Broadening of the chin, still deep on the bone.